The fluorescent lights hum overhead, casting their pale glow across County General Hospital's emergency department. 6:47 in the morning. The night shift drags its feet toward the exit, while day shift trickles in, coffee cups in hand, faces still creased from pillows. Margaret Winters moves through the space like a ghost. 72 years old, silver hair pulled back in a bun so tight it might hurt someone younger. Scrubs 2 sizes too large. Hanging off her thin frame, comfortable shoes worn down at the heels, she wipes down a gurney with methodical precision. Her hands move in patterns too exact for simple cleaning. Circular motions, starting at the corners, working inward, checking wheel locks with her foot without ever looking down. The cloth makes neat squares across the vinyl surface. No spot missed, no shortcuts taken. 3 younger nurses cluster around the station, scrolling through their phones, laughing at something only they can see. Margaret passes close enough to hear their voices. They don't bother lowering them. Did you see her try to log into the new charting system yesterday? Took her like 20 minutes. I had to redo her entire medication count. She still writes everything on paper first. Why do they even keep her? She's got to be pushing 80. Probably some union thing. Can't fire the ancient ones. Laughter. Margaret's expression doesn't change. She continues past them, pushing the gurney toward the supply alcove. Her face remains neutral, eyes forward, shoulders slightly hunched in that way people develop when they've learned to take up less space. She's become a fixture here, part of the furniture, noticed only when something needs doing that no one else wants to do. Dr. Trevor Chen strides past, white coat crisp, stethoscope draped around his neck like a badge of authority. 28 years old. Fresh attending physician, 6 months out of residency and already carrying himself like he owns the department. He doesn't look up from his phone. Margaret, when you finish playing housekeeper, we need a coffee run. 4 lattes from the place across the street. Write it down so you don't forget. I'll take care of it after I restock the crash carts. The carts can wait. Coffee can't. Some of us actually have important work to do. He walks away before she can respond. Margaret pushes the gurney into the supply room. The space smells like disinfectant and cardboard. Metal shelving lines the walls, stocked with IV kits, suction catheters, intubation supplies. Everything labeled and organized according to a system that changed 6 months ago, though Margaret's hands still reach for where things used to be. She begins restocking methodically. IV start kits first. Her fingers assess each package without conscious thought, checking seal integrity, expiration dates, lot numbers, muscle memory functioning like a second sight. She doesn't read the labels so much as feel them, the weight and texture telegraphing information faster than her aging eyes can process the fine print. A younger tech enters, grabs supplies without acknowledging her presence, leaves. Margaret continues working. She moves to the medication cabinet, counts the emergency drugs, signs the log in handwriting that trembles slightly. Not from age, from something else. Something that makes her pause sometimes, mid-task, staring at nothing while her breathing evens out and her jaw unclenches. Margaret. Charge nurse Patricia Valdez stands in the doorway, 43, competent, impatient in that way efficient people develop when dealing with anyone slower. We need someone to sit with the dementia patient in 7. Just keep her calm until psych can see her. Think you can handle that? Of course. Good, that's really more your speed anyway. Something quiet. Valdez leaves. Margaret finishes her count, locks the cabinet, walks toward room 7. Her gait is measured, unhurried. People move around her like water around a stone. No one makes eye contact. Room 7 is dim, curtains half drawn against the morning light. Mrs. Chen sits upright in bed, 86 years old, eyes wide and frightened. Her hands pull at the IV line in her forearm, tugging with increasing agitation. No, they're coming, I can hear them. A medical student sits in the corner, tablet on his lap, looking helpless and exhausted. Margaret enters quietly, doesn't speak at first, just sits in the chair beside the bed and places her hand over Mrs. Chen's hand, not restraining, not forcing, just covering it with firm, steady pressure. Her thumb positions itself exactly over the radial pulse point on the patient's wrist. Her voice drops into a specific register when she speaks, low, steady, rhythmic, like a metronome wrapped in velvet. You're safe here, I'm with you. Nothing is coming. Count with me now. 1, 2, 3. Mrs. Chen's breathing is rapid, shallow, but it begins to slow, matching Margaret's rhythm without conscious intention. 4, 5, 6. The patient's shoulders lower. Her fingers release the IV tubing. 7, 8. 30 seconds pass. Mrs. Chen relaxes completely, her head settling back against the pillow, eyes closing. Her breathing deepens into the even pattern of approaching sleep. The medical student stares. How did you do that? I've been trying for 40 minutes. Margaret doesn't look at him, just continues holding Mrs. Chen's wrist, monitoring the pulse with her thumb. Experience. But what technique is that? What's it called? Paying attention. She releases the patient's hand gently, stands, adjusts the blanket. She'll sleep now. Page me if she wakes agitated again. Margaret leaves the room. The student watches her go, frowning slightly, like he's trying to solve an equation that doesn't balance. At the nurse's station, Valdez is updating the board. Mrs. Chen finally settled down. She's sleeping. Good, she always does eventually, just needs to tire herself out. No mention of Margaret's intervention, no acknowledgement of the skill required to calm someone in the grip of dementia-induced terror without restraints or medication. Margaret moves to her next task, restocking glove boxes in each room, a job usually assigned to the newest nursing assistants. But Margaret doesn't complain, just pulls her supply cart through the department, entering each room, refilling boxes with the same methodical precision she applies to everything. In Trauma Bay 2, she pauses. Her hand hovers over a box of size 7 gloves. Her eyes unfocus slightly. For just 3 seconds, she's somewhere else. Somewhere hot and loud and blood-soaked. Then she blinks, and she's back. And her hand continues its task like the moment never happened. But on her left wrist, barely visible beneath her sleeve when she reaches up, a tattoo, faded with age and sun exposure. Numbers arranged in a specific pattern. Grade coordinates. And below them, 3 letters in block military print, KIA. Margaret pulls her sleeve down, finishes restocking, moves to the next room, invisible again, just the way she wants it. 10:23 in the morning. The ambulance bay doors crash open and the air changes instantly. That shift from routine to urgency that every emergency department knows by heart. GSW incoming, 2 minutes out. The announcement crackles over the intercom, and the department transforms. Nurses move toward Trauma Bay 2. Residents pull on yellow gowns. The attending physician scrubs his hands at the sink, elbows up, water running. Margaret is restocking the crash cart in the corner. She doesn't stop working, just continues her task while the organized chaos builds around her. Invisible as always. The doors burst open. Paramedics rush in, pushing a gurney, their voices overlapping in practiced handoff rhythm. 22-year-old male, a single GSW to right upper quadrant, found unconscious at scene. GCS 7 on arrival. Pressure's been dropping. They transfer the patient to the trauma bay table. Young, Hispanic, blood soaking through the dressings on his abdomen. His skin has that gray quality that means shock. K means bleeding somewhere internal and fast. The trauma team swarms. Dr. Chen takes command position at the head of the bed, his voice sharp with focus. Airway? Patent, but he's obtunded. Get me a tube ready. Breathing? Shallow, rate 28. Breath sounds? A resident places a stethoscope, listens both sides. Clear bilaterally. Circulation? Pressure 90/60, heart rate 130. 2 large bore IVs, push fluids wide open, type and cross for 6 units. The orders come fast. The team executes. This is what they train for. But Margaret sees what they haven't noticed yet. She's 10 feet away, still restocking supplies with mechanical precision. But her eyes track everything. The angle of the patient's neck, slightly hyperextended, jaw thrust forward. The way his chest rises unevenly. The ultrasound image on the screen showing free fluid in Morrison's pouch, dark and expanding. Chen is trying to get a central line in the subclavian vein. His hands shake slightly. First attempt misses. The guide wire won't thread. Damn it! He pulls back, repositions, tries again. Second attempt. The wire kinks. Margaret's jaw tightens. Her hand grips the edge of the crash cart hard enough that her knuckles go white. Something flickers across her face. Something that doesn't belong to a 72-year-old floor nurse doing menial tasks. Desert sand under boots. The sound so loud it becomes physical, pressing against eardrums. Rotor blades cutting the air overhead. A young soldier on a metal floor, 19 years old, bleeding from a wound in his abdomen that looks almost exactly like this one. Her hands inside his chest cavity, holding pressure on a vessel that won't stop pumping blood. "Stay with me, Martinez. Stay with me." His eyes finding hers, terrified and trusting in equal measure. "I can't feel my legs, ma'am." "You don't need to feel them. Just count with me. 1, 2. He died on 7. She never forgot the number. Margaret blinks hard. She's back in County General. Her hand is still gripping the crash cart. A medical student 3 feet away is staring at her with concern. "Ma'am, you okay?" She releases her grip, flexes her fingers, breathes. "Fine." On the trauma table, the patient's pressure drops to 70 systolic. The monitor alarm changes pitch, urgent and insistent. Chen steps back from his failed attempt at the central line, frustration breaking through his professional mask. "Someone else try this." A senior resident steps in, but his hands aren't any steadier. Margaret takes 1 step forward, then stops, forces herself still. This isn't her place anymore. She chose that, chose invisibility, chose restocking supplies and coffee runs and sitting with dementia patients, because those tasks don't require her to make life or death decisions, don't require her to choose who lives, don't require her to count the dead. But her hand moves to her pocket without conscious thought, touches something small and hard and worn smooth from years of handling. A challenge coin. Brass, tarnished, warm from her body heat. On one side, the caduceus. On the other, engraved words she doesn't need to see to remember. 68 Whiskey, Combat Medic, Kandahar Province, 2004 through 2011. She doesn't pull it out, just touches it through the fabric, grounds herself with the weight of it. The patient's pressure drops to 65. His lips are turning blue. Chen's voice rises. "We need to move him to surgery now. OR isn't ready. Then get them ready." But the patient is crashing. Right here, right now. The resident trying the central line pulls back, shaking his head. "I can't get it. The anatomy's off." Margaret's breathing has gone shallow. Her eyes are locked on the patient, on his chest, rising and falling too fast, on the monitor showing numbers that mean he's running out of time. She sees the bleed they haven't found yet, sees it in the way his abdomen is distending, sees it in the pattern of his vitals, sees it with the kind of sight that comes from running triage. Triage in forward operating bases where delay means death. Biamarm screams. Pressure 58 systolic. Someone says something about calling the code, and Margaret's hand releases the challenge coin. Her body goes still, in a different way. Not frozen, not hesitant, centered. The medical student who asked if she was okay is still watching her. He sees something change in her face, something that transforms her from a fragile old woman into something else entirely. Her eyes go flat and focused, her shoulders square, her breathing evens into a combat rhythm. For just 5 seconds, she lets herself be what she used to be, what she swore she'd never be again. Then the moment passes. The team gets the patient stable enough to rush him to surgery. Barely. They wheel him out at a run, leaving the trauma bay looking like a hurricane passed through. Blood on the floor, wrappers and syringes scattered. The monitor still beeping its alarm at an empty bed. Margaret stands in the corner, still holding the crash cart, still invisible. But the medical student is frowning at her, really looking at her for the first time. Because for those 5 seconds, she hadn't looked fragile at all. She'd looked like someone who'd seen worse and survived it. Someone dangerous. Someone who knew exactly what to do and was choosing not to do it. He opens his mouth to ask her something, but Margaret is already walking away, pushing her supply cart toward the next task, her face carefully neutral again, leaving him standing there wondering if he imagined the whole thing. 2:47 in the afternoon. The emergency department has settled into the rhythm between lunch and evening rush. Quiet enough to breathe, busy enough to stay alert. Margaret is in the medication room, counting controlled substances for the shift change. Her reading glasses perch on her nose. She signs the logbook in careful handwriting, each letter formed precisely despite the slight tremor in her fingers. Then the radio crackles. "County General, this is Medic 12. We have a multi-vehicle MVA, 5 patients incoming, ETA 3 minutes, multiple trauma." The department shifts instantly. Charge Nurse Valdez hits the trauma alert button. The overhead speakers announce the incoming casualties. Residents appear from break rooms. Attendings abandon their charting. Nurses prep trauma bays with practiced efficiency. Margaret closes the medication logbook and steps out of the room, stays to the side, out of the way. The ambulance bay doors explode open. First gurney, walking wounded, fractured wrist, some lacerations. Trauma day 3. Second gurney, elderly woman, chest pain, possible cardiac event from the stress. Trauma bay 4. Third gurney, teenager, possible concussion, combative. Trauma bay 1. The teams divide and conquer. Organized chaos. Everyone has a role. Then the fourth ambulance arrives. The paramedics are moving faster. Their faces grim. Male, mid-30s, unrestrained driver, ejected through windshield, GCS 7, hypotensive, multi-system trauma. They wheel him straight into Trauma Bay 2. Margaret is 20 feet away, standing beside the supply cart, watching. The patient is destroyed. Facial bones crushed. Left side of his chest caved in. Blood everywhere. Doctor. Chen takes command, his voice steady, but his movements rushed. Airway first. Someone give me a view. A resident tries to position the laryngoscope, but the facial trauma has distorted everything. The normal landmarks are gone, replaced by swelling and blood and broken bone. I can't see the cords. Try again. There's too much blood. Suction. The suction catheter clears the airway for 2 seconds before blood fills it again. Pressures 80/40. Hang blood. 2 units, wide open. Chest sounds diminished left side. Possible pneumo. Get a chest x-ray. But there's no time for x-rays. The patient's oxygen saturation is plummeting. 90%, 85, 78. Chen tries to place an endotracheal tube, but the anatomy is too distorted. The tube won't pass. Damn it, I need a crike kit. A nurse tears open the surgical airway kit. Chen's hands shake as he tries to palpate the neck, searching for the cricothyroid membrane through tissue that's swollen and displaced. He makes an incision. Too shallow, too lateral. Blood wells up, obscuring his view. I can't find the landmark. The senior resident pushes in. Let me try. But she's no more successful. The scalpel probes. Nothing. Just more blood. The oxygen saturation hits 65%. The monitor alarm is constant now. High-pitched. Urgent. The sound that means someone is dying. We're losing him. Page anesthesia. There ain't another code. Then page surgery. 5 minutes out. The patient's lips are blue, his chest barely moving. Margaret is 15 feet away. Her entire body has gone rigid. She sees everything with perfect clarity. The swelling that's pushed the trachea 2 centimeters to the right. The tension pneumothorax building pressure in the left chest. The rate of blood loss that means internal hemorrhage, probably splenic. She knows exactly what to do, has done it dozens of times. Under mortar fire, in blown-out buildings, with soldiers screaming and ammunition cooking off in the background. This is easy compared to that. But she's not Captain Winters anymore. She's Margaret, the floor nurse, the invisible one. The patient's oxygen saturation drops to 58%. Chen steps back, hands up, his professional mask cracking. I can't. Someone else. No one moves. Everyone is frozen in that terrible moment where training meets reality, and reality wins. The saturation hits 55. Margaret's hands ball into fists. 52. Every muscle in her body screaming at her to move. 50. She sees Martinez, 19 years old, bleeding out on a checkpoint floor. Sees the 14 others she couldn't save. 48. She takes 1 step forward, then another. Her voice cuts through the chaos like a blade. Move. Not loud, but absolute. Everyone turns. Dr. Chen blinks at her. What? Move, now. Something in her tone makes him step aside. Margaret crosses to the head of the bed in 4 strides. Her movements are suddenly different. Faster. Precise. No wasted motion. She strips on gloves without looking down. Scalpel. The nurse stares at her. You're not authorized. That patient has 30 seconds before he's brain dead. Scalpel. Now. The nurse hands it over. Margaret's left hand palpates the neck. Her fingers move through destroyed tissue with absolute certainty, finding structures by feel alone. Years of muscle memory overriding the distorted anatomy. She finds the cricothyroid membrane, makes a single horizontal incision. 1 centimeter. Perfect depth. Bougie. It appears in her hand. She threads it through the incision, feels it pass into the trachea. 60 cuff tube. handed to her. She slides it over the bougie, removes the bougie, inflates the cuff, secures the tube. 14 seconds total. Bag him. Rate of 12. Watch for gastric distension. A resident grabs the bag valve mask, starts ventilating. The oxygen saturation begins climbing immediately. 60, 65, 72. Margaret is already moving to the left side of the chest. Her hand palpates the ribs, counting down. Fifth intercostal space, mid-axillary line. Tension pneumothorax. 14-gauge needle, now. Dr. Chen just stares at her. A nurse hands Margaret the needle. She inserts it at the correct angle, proper depth, and there's an immediate hiss of pressurized air escaping. The patient's blood pressure rises. 90/50, 100/60. Chest tube kit. They hand it to her. She preps the site in seconds. Local anesthetic. Incision. Blunt dissection with a hemostat. Finger sweep to confirm entry into pleural space. Tube inserted, connected to suction. Blood and air drain immediately. The monitor alarms stop. The room falls silent except for the steady beep of a normalizing heart rate. Margaret strips off her gloves, drops them in the waste. Waste bin. Turns to leave. The entire trauma team is frozen, staring at her. Dr. Chen finds his voice first. "Who the hell are you?" Margaret doesn't answer, just walks toward the door. Chen moves to block her path. "You just performed a surgical airway and a chest tube without authorization. Where did you learn that?" "The patient is stable. Someone should get a CT to rule out other injuries." "That's not what I asked." Margaret meets his eyes. Her face is carefully neutral. But something flickers beneath the surface. Something cold and competent and utterly unapologetic. "I'm a nurse with 40 years of experience. Now, if you'll excuse me, I have medications to count." She walks past him, but every person in that room watches her go. And in the corner, the medical student from earlier pulls out his phone, opens a search engine, types military medic tattoo grade coordinates TIA. His eyes go wide. 4:15 in the afternoon. Margaret sits at the nurse's station, charting the medication count she abandoned when the trauma came in. Her handwriting is steady now, each letter precise, face neutral, hands calm. But inside, her heart pounds against her ribs. 13 years of carefully constructed invisibility, destroyed in 90 seconds with a scalpel and a chest tube. She broke cover, completely. The emergency department buzzes around her, whispers that stop when she looks up, stares that dart away when she makes eye contact. The residents cluster near Trauma Bay 2, replaying what they witnessed in hushed voices. "Did you see how fast she moved? That airway was impossible, and she did it in under 20 seconds. No hesitation. Like she's done it 1,000 times." Margaret keeps her head down, focuses on documentation, writes out the controlled substance count with meticulous care, as if the precision of her handwriting can rebuild the walls she just demolished. Dr. Chen stands 15 feet away, arms crossed, watching her with an expression caught between disbelief and suspicion. Charge Nurse Valdez approaches him, her voice low but audible. "What the hell just happened in there?" "I have no idea. Margaret just performed procedures she has no authorization for." "I know. We should report this." "Report what? That she saved a life I was about to lose?" Valdez falls silent. Chen's eyes never leave Margaret. "Find out everything you can about her employment history. Where she trained, where she worked before here, everything." Margaret's pen pauses for half a second, then continues writing. 4:47. The elevator doors open across the department. A man steps out, mid-50s, graying hair cropped close to his skull, wearing civilian clothes, jeans and a button-down shirt, but moving with unmistakable military bearing. His posture is too straight, his scan of the room too tactical, his gait too measured. He walks directly toward the nurse's station. His eyes sweep across the staff, searching. They land on Margaret. He stops walking, goes completely still. His face drains of color like someone pulled a plug. Margaret doesn't look up, but her entire body has tensed, every muscle locked. The pen in her hand motionless above the page. The man takes 2 slow steps closer, stares at her name tag. Margaret Winters, RN. His lips move silently, forming words he doesn't speak. Then, barely above a whisper, "Captain?" The word drops into the space between them like a stone into still water. Margaret's pen stops moving. The conversations around the nurse's station fade. She doesn't look up. "You have the wrong person." The man moves closer, his voice stronger now, carrying certainty. "Captain Winters?" She finally raises her eyes. Her face is stone, carefully blank. "My name is Margaret. I'm a registered nurse. You're mistaken." But the man is shaking his head. His eyes are locked on her face with absolute recognition. "Captain Margaret Winters, 68 Whiskey, Charlie Company, 1st Battalion, 87th Infantry Regiment." Margaret's hands grip the edge of the desk. "I don't know what you're talking about. Kandahar Province, Forward Operating Base Sharana, 2004 through 2011. You're confused. You saved my life." The words hang in the air. Margaret closes her eyes, breathes once, twice, opens them again. "I think you have me confused with someone else. I've worked here for 8 years. Before that, I was at a clinic in July 17, 2009. The man's voice cuts through her deflection like a laser. "IED strike en route uranium. Our convoy got hit. I was the gunner in the lead vehicle. Took shrapnel to the left femoral artery." Margaret's face is white. "I was bleeding out in the back of the MRAP. Everyone else was dealing with the driver and the other casualties. You came for me. That wasn't. You cut my pants open, put your hands inside my leg, held the artery closed with your fingers for 43 minutes until the medevac arrived." Margaret says nothing. The entire nurse's station has gone silent, every person listening now. The man's voice shakes. "You wouldn't let me look down, kept my eyes on yours, made me count with you, 1 to 10, over and over. You told me if I kept counting, I'd stay alive." He rolls up his left sleeve. A tattoo covers his forearm, a date in block numbers, 07-1709. Below it, Captain M. Winters. Below that, the Angel of Sharana. The whispers explode. Margaret stands abruptly. Her chair scrapes across the floor. "I'm sorry, you have me confused with someone else." She tries to walk away, but the man moves to block her path. Not aggressive, not threatening, just there, solid and certain. "Captain Margaret Ann Winters, serial number 47293821. 3 combat medical badges, 2 bronze stars with Valor device, 1 silver star for actions under enemy fire." Margaret's breathing is shallow. That woman doesn't exist anymore. That woman is standing right in front of me. She died the day she took off that uniform. The man's voice drops, gentle now, but carrying across the silent department. "Then who saved Corporal Martinez when the checkpoint got overrun? Who held Private Chen together after the mortar attack on Checkpoint Delta? Who ran into a burning MRAP while the fuel tank was cooking off to pull out Sergeant Dawson?" Each name hits Margaret like a physical blow. Her jaw clenches. Her hands ball into fists. "Those people I couldn't save. You saved 37 soldiers over 7 years of deployment. I lost 14. Her voice cracks. 14. I remember every single name, every single face, the exact time each one died. You remember them because you cared, because you tried everything, because you wouldn't give up even when I gave up the day I left." Margaret's voice is hard now, brittle. "I gave up because I couldn't carry them anymore. Couldn't close my eyes without seeing Martinez die. Couldn't hear helicopters without remembering medevacs that arrived too late. Couldn't." She stops, breathes. The man watches her with something like understanding. "We thought you were dead, Captain. The whole company. You disappeared. No forwarding address, no contact information, no response to letters. We tried to find you for the 10-year reunion. I didn't want to be found. Why?" Margaret looks at him, really looks at him. And her eyes are full of something too vast for words. "Because I couldn't be that person anymore, Colonel Herrick. Because every time someone called me captain, I heard them dying. Because I needed to save people without counting how many I'd already lost." Lieutenant Colonel James Herrick, retired, stands very still. "So you became invisible. I became a floor nurse. Someone no one notices. Someone who restocks supplies and takes coffee orders and sits with dementia patients. Someone simple. There's nothing simple about you. There is now." She steps around him. I'm sorry you came all this way, but Margaret Winters died in Afghanistan. The woman standing here just happens to have the same name. She walks away, but every person in that emergency Y department is staring now, and Dr. Chen, standing near the trauma bay with his phone in his hand, is looking at a Google search result. Captain Margaret Winters, Medal of Honor nominee, Silver Star recipient, Afghanistan combat medic, 37 confirmed saves, known as the Angel of Sharana, disappeared from military records, 2011, presumed retired, never heard from again, until today, 5:34 in the afternoon. Margaret stands in the supply room with the door closed, her back pressed against the metal shelving, eyes closed, hands trembling now that no one can see them. Delayed stress response, adrenaline crash. The walls she spent 13 years building crumbling brick by brick. She breathes, counts to 10, then 10 again. Her hand moves to her pocket, touches the challenge coin, worn smooth, warm from her body heat. She doesn't pull it out, just holds it through the fabric. Grounds herself with the weight of memory. Then a sound pierces through the door, shouting, running footsteps. The overhead speakers crackle to life. Mass casualty alert. Bus accident on Highway 41. 15 incoming. Multiple criticals. All available staff to trauma bays. ETA 4 minutes. Margaret's eyes snap open. She moves to the door, cracks it open. The emergency department has erupted into controlled chaos. Staff running. Gurneys being positioned. Trauma bays prepped. Dr. Chen barking assignments with increasing urgency in his voice. You take Trauma 1. You take 2. We need more hands. Someone call in off shift. They're 20 minutes out. We don't have 20 minutes. The first wave hits before anyone is ready. Ambulance doors crash open. Gurneys flood in. Too many. Too fast. Children crying. Adults screaming. Blood everywhere. The organized chaos becomes just chaos. A resident stands frozen over a 10-year-old boy whose chest rises and falls too rapidly, his lips tinged blue, respiratory distress. The resident's hands hover, uncertain. I need, someone tell me, but everyone else is drowning in their own patience. Margaret sees it from across the room, sees the child's neck veins distended, sees the tracheal deviation, sees the tension pneumothorax that will kill him in minutes. The resident fumbles for a stethoscope. Too slow. The child's oxygen saturation drops. 88, 83. Margaret's body moves before her mind decides. She crosses the emergency department in 10 strides. No longer slow. No longer invisible. Move. The resident looks up. I've got this. You have 5 seconds before this child dies. Move. Something in her voice makes him step aside. Margaret's hands don't shake anymore. They're rock steady as she palpates the child's chest. 5th intercostal space, mid-axillary line. She marks it with her finger. 14-gauge catheter. Now. A nurse hands it to her. Margaret inserts the needle at the correct angle. Immediate hiss of escaping air. The child's color improves instantly. She doesn't wait for thanks, just moves to the next patient. Elderly male, flail chest, 3 ribs broken on the right side, breathing shallow and rapid. Positive pressure ventilation. Careful with tidal volume or you'll cause a pneumothorax. Someone start a line and get pain control on board. Next patient, middle-aged woman, hypotensive, abdomen rigid on palpation. Margaret's hands assess in seconds. Intra-abdominal hemorrhage, likely splenic rupture. Type and cross 6 units. Get surgery down here now. She's not asking permission anymore, not requesting, commanding. And the staff, overwhelmed and terrified, obeys without question. Because her voice has changed completely. The fragile uncertainty is gone. This is someone else, someone who has run mass casualty events in places where mistakes meant body bags. Margaret moves through the chaos like she's conducting a symphony. Every instrument in the right place, every note timed perfectly. You, bag that patient, rate of 12, watch for gastric distension. You, direct pressure on that femoral bleed, don't let go until I tell you. You, hang 2 liters of ringers wide open, then reassess. Dr. Chen stands near the nurse's station, watching her transform the chaos into something manageable. His phone hangs forgotten in his hand. The department is still overwhelmed, still desperate. But it's working now, organized, efficient, because Margaret Winters has stopped pretending. Then another sound cuts through the noise, low, rhythmic, growing louder. Whump, whump, whump. Everyone freezes, looks up. The windows rattle in their frames. The distinctive percussion of rotor blades. Close, getting closer. A helicopter. Not the medical transport kind, the military kind. It passes directly overhead. The lights flicker. Equipment vibrates on the shelves. The helicopter circles once, then descends. Impossible. Civilian hospitals don't have military landing zones. But the sound grows louder until it's almost deafening, then cuts to idle. Through the ambulance bay windows, staff can see it settling onto the pavement. A Black Hawk, matte green, no medical markings. The side door opens. 4 figures emerge in combat fatigues, moving with tactical precision, and leading them, a man in full dress uniform, 3 stars on his shoulders, catching the afternoon light. Lieutenant General Marcus Holloway strides toward the emergency department entrance, like he owns every inch of ground beneath his feet. The automatic doors open. He walks through without breaking stride. Staff scatter out of his path. His eyes scan the department with military efficiency, assessing, categorizing, finding his target. They land on Margaret. She's holding pressure on a chest wound, blood coating her gloves up to the wrists, hair falling out of its careful bun. 72 years old, looking more like herself than she has in 13 years. General Holloway crosses the room in 6 strides, stops 3 feet from her, comes to attention, renders a perfect salute. Captain Winters. The entire emergency department goes silent. Margaret doesn't look up from her patient, just continues applying pressure. I'm busy, General. I can see that. Then you can also see I'm not in your chain of command anymore. Which is why I'm asking, Captain, not ordering. Margaret finishes applying a chest seal, secures it, wipes her hands on a towel, finally looks at him. Asking what? Chemical plant explosion 60 miles north. Chlorine gas release. Mass casualty event. 90+ victims. Local hospitals are completely overwhelmed. We're setting up a field hospital, but we need someone who can run triage in an active contamination zone. You have combat medics for that. None with your experience running multi-casualty scenarios. None with your save rate. I've been out for 13 years. You just organized this emergency department in under 8 minutes. His voice is matter of fact. Your hands didn't shake once. Your commands were textbook field triage protocol. You prioritized patients by survivability and available resources without hesitation. Margaret says nothing. General Holloway steps closer. His voice drops to something almost gentle. Captain, I know you left for reasons. I know you wanted to disappear. But right now, there are 90 people who need the angel of Sharana, not Margaret the floor nurse. You. Margaret closes her eyes. Behind her, Dr. Chen finally finds his voice. It comes out strained. She doesn't have authorization to deploy with military units. She's not cleared for. General Holloway turns, looks at Chen. His voice could freeze water. This woman has more combat medical experience than your entire attending staff combined. She's run triage under mortar fire. She's performed field surgery in buildings with no power and no support. She has saved more lives in worse conditions than you will see in your entire career. He turns back to Margaret. I'm not ordering you, Captain. I can't. You're retired, civilian. I'm asking. Will you come? Margaret looks at the emergency department, at the patients being stabilized, at the staff who hours ago thought she was barely competent, at the children who would have died without her. She reaches into her pocket, pulls out the challenge coin, looks at it for 5 long seconds, then closes her fist around it. I need 10 minutes to brief the charge nurse on these patients. You have 5. Margaret turns to the assembled staff. When she speaks, every person listens. Trauma 1 needs surgical consult within the hour. Trauma 2 is stable, but watch for tension pneumo. It could recur. Trauma 3 needs pain control and ortho evaluation. Everyone else follows standard protocol. She strips off her gloves, looks at Dr. Chen. Keep them alive until I get back. Then she walks toward the general without looking back. 72 hours later. County General Hospital, Emergency Department. Morning shift change. The rhythm of routine restored. Dr. Chen stands at the nurses' station staring at his tablet. A news report plays on loop. Chemical plant disaster response praised for 0 fatalities. Military Field Hospital processes 93 victims with 100% save rate. Unidentified medical officer credited with flawless triage protocol under hazardous conditions. There's video. Grainy footage shot on someone's phone from behind a decontamination barrier. A field hospital tent. Green canvas snapping in the wind. Chaos visible even through the camera shake. And in the center, directing everything, a woman in borrowed combat fatigues. Gray hair pulled back tight. Moving between patients with absolute precision. Her voice carries across the recording, giving orders in that tone that allows no argument. The angel of Sharana. Back where she belonged, if only for 3 days. Chen closes the tablet, looks at the empty chair where Margaret used to sit doing her charting. Where she used to be invisible. The elevator doors open. Margaret walks out. Hospital scrubs, hair pulled back in her usual bun. Looking exhausted. Dark circles under her eyes. But something in her posture is different now. Less hunched, more centered. The emergency department goes quiet. Everyone turns to look. Margaret stops at the nurse's station, meets Chen's eyes. I'm back for my shift. Chen stands, opens his mouth, closes it. Tries again. Captain, it's Margaret. Margaret. He corrects himself carefully. You don't have to work today. After 3 days in a contamination zone, you should. I signed up for a shift. I'm here to work it. She picks up a clipboard from the rack, scans the patient board like nothing happened. Like she didn't just spend 72 hours running a field hospital in a chemical exposure zone. Like she's still just the old nurse who takes coffee orders. Chen steps forward. Wait, please. Margaret stops, doesn't turn around. Charge Nurse Valdez approaches from the other side. Her face is drawn, like she hasn't slept well. Margaret, the staff and I, we need to say something. Margaret's shoulders tense. That's not necessary. Yes, it is. Valdez's voice is firm. We treated you like you were less than us. We made assumptions based on your age, your willingness to take tasks nobody else wanted, your quiet demeanor. We were wrong, completely wrong, and we're sorry. Other staff members gather now. Residents, nurses, techs, the medical student who first noticed her tattoo. All watching. Margaret turns slowly. Her face is carefully neutral. You treated me exactly how I presented myself. There's nothing to apologize for. There is. Chen steps closer. His hands are clasped in front of him like he's holding something fragile. Because even if you wanted to be underestimated, we should have seen your competence. We should have recognized your skill, and we didn't. Because we were lazy, arrogant. We judged you without looking. Margaret says nothing. Chen continues, his voice gaining strength. So we made changes, starting today. He nods to Valdez. She pulls a folder from behind the desk, opens it. We've implemented a new departmental protocol, mandatory competency recognition, on training for all staff. We're also establishing a clinical mentorship program, pairing experienced nurses with newer attendings, so that expertise is valued regardless of title, rank, or age. Margaret's eyes widen slightly. You don't need to do that because of... We're not doing it because of you. Valdez's voice is gentle but firm. We're doing it because you showed us a systemic problem. You're not the only experienced person we've overlooked. You're just the one who finally made us see it. She hands Margaret a document. Clinical Mentorship Initiative. Lead Coordinator. Margaret Winters, RN. Margaret stares at the paper like it's written in a language she doesn't speak. I'm just a floor nurse. You're a decorated combat medic with 7 years of field experience. Chen's voice is quiet now. You have a perfect save rate in mass casualty situations. You've run triage under conditions most of us can't imagine. You're exactly who should be leading this. Margaret looks up from the document. I left that life behind. I came here to be ordinary. We're not asking you to be Captain Winters. Chen meets her eyes. We're asking you to be Marnwit, the nurse who knows things the rest of us don't. The nurse who can teach us how to stay calm when everything is falling apart, how to see what we're missing, how to trust our hands when our minds are panicking. The department is completely silent now. Margaret looks at the document again, at her name printed in official hospital letterhead. Her hands don't shake, but something flickers across her face, something vulnerable and uncertain and almost afraid. What if I can't? What if I teach you what I know and people still die? Then they die. Valdez's voice is soft. But they won't die because we didn't try, because we didn't use every resource we had, because we let pride or assumption or laziness get in the way of competence. Margaret is quiet for a long moment. Then she nods. Okay. The emergency department erupts in applause. Not loud, not showy, just quiet, sincere acknowledgement. Margaret nods once, tucks the document under her arm. Then, but I'm still taking supply restocking duty. I find it meditative. Chen almost laughs. The sound is startled out of him. Deal. 2 weeks pass. Margaret is in Trauma Bay 2 with a young resident. 26 years old, competent on paper, terrified in practice. He's attempting a central line on a critical patient. Hypotensive, needs access, needs it now. First attempt misses. The guide wire won't thread. His hands start shaking. I can't. Stop. Margaret's voice is calm. Breathe. You're rushing because you're scared. Fear makes you sloppy. The resident nods, breathes. His hands steady slightly. Now close your eyes. What? Close them. Feel the anatomy. Visualize the structures. The vein is there. Your hands know where it is. Trust them. He closes his eyes. His fingers palpate the neck, finding landmarks by touch alone. Now place it. He opens his eyes, inserts the needle. The guide wire threads smoothly. Perfect placement. First try. He looks up at Margaret with something like wonder. She nods once. Good. Now secure it and document. And remember this feeling. Your hands knew what to do. You just had to get out of their way. She walks toward the door, pauses, looks back. You have good instincts. Start trusting them. At the nurse's station, Chen watches the interaction. Valdez stands beside him. She's good at this, Valdez nods. She always was. We just didn't let her be. Chen is quiet. Then, do you think she's forgiven us? Valdez considers the question. I think she never blamed us in the first place, which somehow makes it worse. 1 month later, Margaret opens her locker at the end of her shift. Inside, among the spare scrubs and the protein bars, hangs something new. A framed photograph. 93 people standing in front of a military field hospital tent. Workers in decontamination suits. Patients in hospital gowns. Military personnel in fatigues. Every single one alive. Very single one saved. And in the center, Margaret in borrowed combat uniform, looking more like herself than she ever does in civilian scrubs. A note is attached to the frame. Captain, you said you couldn't carry the ones you lost. Maybe it's time to carry the ones you saved. Respectfully, General Holloway. Margaret stares at the photo for a long time. Her fingers trace the faces, counting them silently. 93 plus 37 from Afghanistan. 130 lives against 14 losses. The math still doesn't balance in her mind. It never will. But maybe that's not the point. Maybe the point is that she's still here, still counting, still trying. She hangs the photo inside her locker, where no one else can see it. A private reminder, not of who she was, but of who she still is. When it matters most, 6 months later, County General Hospital, Emergency Department, 5:47 in the morning. The fluorescent lights hum their familiar rhythm. Coffee brewing in the break room. Night shift completing final charts. Day shift trickling in with sleep still in their eyes. Margaret Winters walks through the automatic doors. Same scrubs, same quiet demeanor, same measured gait, but everything else has changed. Staff members nod as she passes, not out of pity, not out of obligation, out of respect. Real respect. Morning, Margaret. Good morning. Coffee's fresh if you want some. Thank you. She moves to the nurse's station where Dr. Chen stands reviewing overnight admissions on a tablet. He looks up when she approaches. Morning. Morning, Trevor. First names now. That shift happened gradually over 6 months. A small thing that means everything. Chen sets down his tablet. We have a new resident starting today. First rotation out of medical school. Smart kid but nervous as hell. I told him you'd orient him. Margaret raises an eyebrow. You want me to orient the new doctor? I want you to teach him what matters. Not what's in the textbook. The things that make the difference between freezing and functioning. She considers this. Nods. Where is he? Break room. Probably reviewing protocols for the 15th time. Margaret walks to the break room. Finds a young man standing by the window, staring at his phone with wide eyes. His white coat is too stiff. New. His stethoscope still has the price tag tucked inside the bell. Dr. Morrison? He jumps, nearly drops his phone. Yes. Sorry, I'm just first day and I'm nervous. I know. Margaret's voice is calm. I'm Margaret. I'll be showing you around today. Relief washes over his face. Thank you. I've been reading the protocols, but there's so much and I'm not sure. The protocols are guidelines. They'll get you started. But the most important thing isn't what you memorize. It's staying calm when you don't have answers. He nods, pulling out a small notebook. Margaret almost smiles. Come on, let me show you the department. She walks him through each station, supply rooms, trauma bays, medication dispensaries, speaking in that measured tone that makes information stick. The equipment is logical once you understand a layout, but equipment is secondary. The primary tool is you, your observation, your judgment, your ability to function under pressure. Morrison takes notes rapidly. They stop outside Trauma Bay 1. This is where you'll learn the most, not from success, from uncertainty, from the moments when you don't know what to do next. How do I handle that? Margaret turns to face him. You breathe, you assess, you ask for help when you need it, and you remember why you're here. She gestures toward the waiting room visible through the glass. People in various states of distress. A mother holding a feverish child. An elderly man clutching his chest. A teenager with a swollen ankle. They need you to be steady, so you find a way to be steady, even when everything inside you is screaming. Morrison looks at her with something approaching awe. Is that what you do when things get bad? That's what everyone here does. You'll learn. I heard about what happened 6 months ago, the bus accident, the chemical plant. Everyone says you're like a legend. Margaret's expression doesn't change. I'm not a legend. I'm a nurse who's seen some difficult situations and learned from them. But you were military, right? Special operations, or I was a medic. I did my job. Now I do this job. Her tone makes it clear the topic is closed. Morrison nods, sensing the boundary. Come on. Let me show you the medication system. It's counterintuitive and will make you want to throw things, but you'll adapt. 3 hours later, Margaret sits in the cafeteria at her usual table by the window, reading a journal article on updated sepsis protocols. A cup of tea cooling beside her. Someone sits down across from her. Colonel James Herrick, retired. The man who recognized her 6 months ago and changed everything. Colonel. Ma'am. They sit in comfortable silence for a moment. Then Herrick speaks. I heard about the mentorship program. 12 hospitals across the state are implementing it now. News travels. It does when the program has a 94% satisfaction rate and measurable improvement in resident confidence metrics. Margaret closes her journal. It's not about me. It's about recognizing competence wherever it exists. That's exactly why it works. Herrick leans forward slightly. You know what the company talks about when we have reunions? I wouldn't know. I don't attend. We talk about how you saw things no one else saw, how you trusted people's skills even when they didn't trust themselves, how you made everyone around you better just by being calm. Margaret's hands rest flat on the table. I also made mistakes, lost people I should have saved. You lost 14 in 7 years of combat deployment. The statistical average for combat medics in equivalent positions was 32. Statistics don't bring them back. No, they don't. Herrick's voice is gentle. But they mean something. They mean you gave them every possible chance. That's all anyone can do. Margaret is quiet. Then, why are you here, James? Because I wanted you to know something. The company took a vote. We're establishing a scholarship fund for people pursuing emergency medicine. People who might not otherwise afford it. He slides a folder across the table. We're calling it the Angel of Sharana Memorial Fund. We'd like your permission to use the name. Margaret opens the folder, reads the first page. Her eyes go wet. She doesn't cry, but she closes the folder carefully and pushes it back. Use whatever name you want, but I'm not a memorial. I'm still here. That's exactly why we want your permission. Because you're still fighting, still saving people. Still teaching others how to do the same. Herrick stands. Think about it. No pressure. But 37 soldiers want to honor the person who gave them a second chance at life. Consider letting us. He leaves. Margaret sits alone with the folder, stares out the window at the city moving through its daily rhythm. After a long moment, she opens the folder again. reads through the scholarship criteria, the application process, the funding sources. At the bottom of the last page, a list of names, 37 signatures, every soldier she saved, all alive, all remembering, all trying to pass forward what she gave them. Margaret traces the names with one finger, then closes the folder, tucks it under her arm, returns to work. 6:30 in the evening, end of shift. Margaret changes out of her scrubs in the locker room. Inside her locker, the two photographs hang side by side now. 93 people from the chemical plant, 37 soldiers from Afghanistan, 130 lives, and below them, something new. A third photograph. The emergency department staff. Doctors, nurses, residents, technicians, all gathered together during last month's departmental meeting. And in the center, looking uncomfortable but present, Margaret. A sticky note attached in Dr. Roger Chen's handwriting, to the nurse who taught us what real competence looks like. Your ER family. Margaret touches each photograph gently, counts the faces silently. The ones she saved, the ones she's teaching, the ones who see her now, really see her, not as the fragile old nurse, not as the invisible one, as Margaret Winters, both the person she was and the person she became, no longer hiding from either. She closes the locker, gathers her things, walks through the emergency department one last time before heading home, past the trauma bays where she saved lives, past the supply rooms where she found peace in routine, past the nurses' station where she was once invisible and is now essential. She pauses at the exit, looks back at the department. Organized chaos, controlled urgency, people doing their absolute best under impossible pressure, the way it should be, the way she helped make it. Dr. Morrison, the new resident, catches her eye from across the room. Weighs tentatively, she nods back. He'll be fine. They all will. Because now they know what she knows, that competence doesn't announce itself, that experience matters more than ego, at the quietest person in the room might be the one who knows the most, and that giving up is never an option, not when lives depend on you. Margaret walks out into the evening, into her quiet life that's no longer quite so quiet, where she is both Margaret the nurse and Captain Winters the combat medic, no longer hiding from her past, no longer running from her grief, just being both versions of herself, simultaneously, completely, and finally, after 13 years of invisible penance, at peace with the person she is, the person she always was, the person who refuses to give up, no matter what. 7 years later, County General Hospital, Emergency Department, early morning, the rhythm unchanged, the familiar hum of fluorescent lights, coffee brewing, monitors beeping their steady cadence, but the faces have changed. New residents, new nurses, a new generation of medical professionals moving through the space with confidence, built on a foundation someone else laid. Margaret Winters walks through the department at 79 years old, slower now, a cane in her left hand, but her eyes are still sharp, still seeing everything. She's not working the floor anymore. That ended 2 years ago when her knees finally gave her the ultimatum her mind never would. But she's here 3 days a week, teaching, mentoring, observing. The clinical competency director, a title she never wanted and still feels uncomfortable claiming. A young resident approaches her near the nurses' station. 27 years old, confident, but not arrogant. The mentorship program taught her the difference. Margaret, do you have a minute? I have a patient I'd like you to assess. Show me. They walk to Trauma Bay 3 together. Inside, a middle-aged man with chest pain. Vitals stable, but something feels wrong to the resident. She can't articulate what, just a sense. Margaret observes from the doorway, doesn't touch the patient, just watches. The way he breathes, the slight grimace he tries to hide, the position of his hand on his chest, fingers spread wide rather than clutched. What's your instinct telling you? Margaret asks quietly. That something's wrong beyond the obvious presentation. Trust that. What are you missing? The resident looks again, really looks. His pain pattern. It's not typical angina distribution. Good. What else? The way he's guarding, like he's afraid to move his torso. So what's your next step? Expanded imaging. Rule out aortic dissection. Margaret nods. Go. And remember this moment. Your instinct saw what the monitors didn't. That instinct will save more lives than any protocol. The resident orders the imaging. It confirms the dissection. The patient goes to surgery within the hour. Lives because someone trusted their instinct. Dr. Chen, now chief of emergency medicine, watches the interaction from his office window. He's 42. Now, graying at the temples, carrying the weight of leadership with more grace than he had at 28. Margaret joins him a few minutes later. Dr. Morrison is excellent, she says, settling into the chair across from his desk. She has good instincts, and she's learning to trust them. She had a good teacher. She had many teachers. I'm just one voice. Chen smiles. You're being modest again. I'm being accurate. He pulls a folder from his desk, opens it. I wanted to show you something before the board meeting next week. The hospital system is expanding the mentorship program to all 17 facilities. They're also establishing a formal fellowship, advanced training in crisis medicine and competency recognition. He slides a document across the desk. They want to name it after you. Margaret reads the header, the Winters Fellowship in Emergency Medical Competency. She's quiet for a long moment. I don't need my name on anything. It's not about what you need, it's about what it represents. A commitment to recognizing skill over assumption, experience over ego, competence over credentials. Margaret traces the words with one finger. Use my full name then, Captain Margaret Winters. Let people know that skills transfer, that military medics become civilian nurses, that experience has value wherever it's gained. Chen nods. I'll make sure they do. Margaret stands, leaning on her cane. I need to observe the new trauma protocols in Bay 1. Dr. Patterson requested feedback. Margaret, before you go, Chen stands as well. I never properly thanked you for what you taught me about humility, about really seeing people. You learned it yourself. I just gave you the opportunity. No, you gave me more than that. You showed me what I was missing, what we were all missing, and you did it with grace I didn't deserve. Margaret meets his eyes. Everyone deserves grace, Trevor, especially when they're learning. She leaves his office, moves through the department that's become her legacy without her name on any walls. The residents who trust their instincts, the nurses who speak up when something feels wrong, the attendings who listen to the quiet voices, all of it rippling outward from one woman who refused to stay invisible when it mattered most. Afternoon. Margaret sits in the hospital courtyard, sun warm on her face, a book in her lap that she's not reading. Colonel Herrick finds her there, older now, 73, but still moving with military precision. Ma'am, James, you're persistent. It's been 6 months since I asked. I figured I'd check in. He sits beside her on the bench. The scholarship fund has sent 43 students through medical school now. 43 people who couldn't have afforded it otherwise. Every single one has gone into emergency medicine or trauma surgery. That's good work. They want to meet you, the recipients. There's a dinner next month. Margaret is quiet. I'm not good at those things. I know, but they want to thank you. The way I thanked you. The way 37 soldiers thanked you. Let them. She looks at him. Will you be there? Every single one of us who can travel. We're not as young as we used to be, but we remember. We all remember. Margaret nods slowly. I'll think about it. That's all I ask. He stands to leave, pauses. You know what the best part is? Those 43 scholarship recipients. They're teaching others now. Using what they learned, passing it forward. You didn't just save 130 people, Captain. You created a cascade. Thousands of lives touched because you refused to give up. He leaves her sitting in the sun. Margaret closes her eyes, counts silently. 130 direct saves, 43 scholarship recipients, 217 residents trained through the mentorship program, 17 hospitals implementing the protocols. The math spirals outward beyond her ability to count, beyond her ability to track. But she feels the weight of it. Not burden, responsibility. The good kind. Evening. Margaret's apartment. Small, efficient, neat. She sits at her kitchen table with a cup of tea and the folder from Colonel Herrick. Opens it. Looks at the list of scholarship recipients. 43 names. 43 faces in the attached photographs. Young, hopeful, competent. All of them carrying forward something she gave them without ever meeting them. On her refrigerator, held by magnets, 3 photographs. The 93 from the chemical plant. The 37 from Afghanistan. The County General Emergency Department staff. 130 faces looking back at her, reminding her, not of who she lost, of who she saved, who she's still saving. Margaret pulls out a piece of paper, writes in her careful handwriting, "Dear scholarship recipients, I will attend the dinner, not because I need recognition, but because you deserve to be seen. The way I once needed to be seen. The way we all need to be seen. Thank you for carrying this work forward, for choosing to serve, for learning that competence is built on humility and persistence. Save them. All of them. Every single one you can. And when you can't, remember their names. Carry them forward too. Respectfully, Captain Margaret Winters." She seals the letter, sets it aside to mail tomorrow, then sits in the quiet of her apartment, 79 years old. A combat medic who became a floor nurse, who became a teacher, who became a legacy. Not through heroism, through competence, through showing up, through refusing to give up. Even when giving up would have been easier, especially then. Outside her window, the city moves through its evening rhythm. Ambulances somewhere in the distance. People living and dying and being saved by professionals who learn to trust their instincts, who learn to see what others miss, who learn that the quietest voice might carry the most important message. Margaret closes her eyes, counts one more time. Not the dead, the living, all of them, every single one, and smiles. The camera pulls back slowly, through the window, rising above the apartment building, above the city, above everything, until Margaret is just one light among millions, one person who made a difference, not by being extraordinary, but by being exactly who she was, when it mattered most. Text appears on screen. Margaret Winters continued teaching at County General until age 81. The Winters Fellowship has trained over 400 emergency medicine specialists. The Angel of Sharana Memorial Scholarship has funded 127 medical students. The Clinical Competency Recognition Program operates in 43 hospitals across 6 states. Captain Winters passed away peacefully at age 83. Surrounded by former students who became colleagues, who became friends, her funeral was attended by 217 people whose lives she directly touched, and thousands more who never met her but were saved by people she trained. She never spoke publicly about her military service, but every person she taught carried forward her most important lesson. Competence doesn't need recognition. Experience doesn't demand respect. And the measure of a life isn't in the titles you hold or the medals you earn. It's in the quiet moments when you refuse to give up, when you trust your hands, when you see what others miss, when you teach others to do the same. Some heroes wear uniforms, some wear scrubs, and the greatest ones teach others to be heroes too. Not through words, through example, through persistence, through grace. The screen fades to black. In a world that judges by appearance, remember this. The fragile old nurse restocking supplies might be the most competent person in the room. The quiet voice might carry the most important message. The person you underestimate might be the one who saves your life. Look closer, listen better, and never assume you know someone's story. Because competence doesn't announce itself. It simply is, waiting for the moment when it matters most. Fade out. End.